Here are the hidden dangers of semaglutide. What your doctors may not be telling you about Ozempic, Wegovy. There are real risks that you need to know about your health before you decide on getting on this medication. So I know there's a lot of hype about Ozempic, Wegovy, Zepbound, Mondala, all these medications to help with weight loss. Well, I'm here to tell you as a lifestyle medicine integrative doctor who focuses on gut health, mental health, and all things health, you need to watch out for these dangers. Number one, watch out for suicide ideations. You didn't know that studies have shown over long term that there's an increased risk of wanting to kill yourself. Did you know that actually is because it's messing with your serotonin in your gut? Yes, semaglutide can alter the hormones in your gut. So there's more risk of wanting to harm yourself. And that is so tragic and sad. There needs to be a big black box warning on this medication. This is very harmful because if someone already has depression, anxiety, which a lot of people do, it can increase the risk for depression, anxiety, and even suicide. So what do we need to do about it? We need to know the pros and cons of this medication and know the research. The research shows that 45% of those who are taking Ozempic have an increased risk of suicidal. And if they're already on a medication for depression, anxiety, something such as an SSRI that increases serotonin, there's even more of a risk, up to 345%. Wow. Take a step back. This is dangerous. So you want to be sure if you are thinking about that, even for your teens, 20-year-olds, 30-year-olds who have higher risks of suicidal, you want to be careful. And sadly, Ozempic has been hot on the market for now childhood obesity. It's being researched and now they're going to start implementing in our children who have higher risk of depression, anxiety, and suicide. So think twice and even more if you want to take this medication. So I know semaglutide is only known for side effects such as saggy breasts, loss of skeletal muscle, some muscle wasting, facial wasting, but it's more serious than that. There's such things as small bowel obstruction, and small bowel obstruction is because they're slowing down of the gut. Yes, you have semaglutide that actually helps with insulin secretion. It's great for those with type 2 diabetes and obesity, but also it slows down the gut so you can't eat as much. You eat smaller and it decreases your appetite. However, if you get constipated, you're not eating enough fiber, plant-based foods, it's going to cause not just constipation, but the poop can actually cause an obstruction. And this is a medical emergency. This requires an ER visit and sometimes not only just fasting, but surgery. So we have to be very careful about using this medication, especially if you're getting this medication off-label, off the market, and online. I have some patients who just found an online source or some other spa down the street without getting medical supervision. And this is heartbreaking for me because there's such high risk and we need to have good, solid lifestyle interventions before trying this medication and during the medication. Yes, you may get that sudden weight loss, but remember, studies do show after 62 weeks, meaning a year and a quarter, that the weight comes back. So what does that mean? About only 12% of those people who were on semaglutide were successfully able to keep the weight down. And usually that's because they are retreating back to their old lifestyle choices. If it was eating fast food, sugary food, junk food, oily foods, they end up bringing that back in. And I do love the medication because it does suppress appetite, even alcohol cravings, which is a good thing. But when you stop the medication and go back to the sugary foods, including alcohol, you're just bringing back the problem and not getting to the root cause. So be very careful when taking this medication. In addition, there's an increased risk of pancreatitis. I see this time after time, patients who go up on the medication very, very fast and don't realize that it is causing nausea, vomiting, stomachache, bloating, reflux. But those are early signs of pancreatitis. So that means their pancreas is inflamed and overworking. That means that the insulin, glucagon is all confused in the pancreas. Guess what? What's the treatment? It's going to the hospital, fasting, and sometimes getting some high doses of pain medications and IV fluids. It is not fun. It's one of the most painful things someone can experience. So be careful of pancreatitis. And if that's you, make sure you talk to your doctor. They may want to check labs such as lipase, and CMP, which means it checks for liver function enzymes and your bile ducts. So all in all, taking semaglutide increases risk for pancreatitis. Another important thing about checking those labs is you don't want gallstones. It's common to have gallstones sitting in your gallbladder. It's common for it to develop because you have high cholesterol or imbalance in your foods and your salts. However, if you take semaglutide, you have increased risk of gallstones, especially cholecystitis. What does that mean? It means the gallbladder gets inflamed and the duct, the common bile duct, may have a gallstone that gets stuck in the middle of the common bile duct, which causes not only obstruction, meaning blockage, inflammation, and potentially bursting that gallbladder. So this can be very deadly. So be careful with gallstones, especially if you're taking this medication. You may not even know that you have gallstones, and when you take semaglutide, you have an increased risk of getting cholecystitis. Why is that? Because you have more enzymes, more bile acids that are moving, and you may not be taking, once again, the proper foods. If you're still eating more greasy animal-based foods, you're likely gonna have an increased risk of gallstones and cholecystitis. And another big problem is stomach paralysis. So you have 3.7 times more risk of paralysis. Study has shown that yes, you may have suppressed appetite, but you may not getting a poop until a whole week later. Now, that's uncomfortable. I don't know about you, but I love my daily poop. I like it soft, and I don't like it in pebbles or hard poop. I want something gentle so that doesn't make me strain and doesn't increase my risk for internal or external hemorrhoids. So let me tell you, if you are taking semaglutide, make sure you have proper hydration, increase water intake, especially having enough fiber in the form of whole food plant-based eating. So please remember, your plants are going to be your best friend while taking semaglutide. So why is the FDA silent about all these risks? It's so disturbing. Yes, there's some warnings about thyroid medullary cancer, but there's some other hidden dangers of semaglutide. One of them is vision loss. That's one of the hidden dangers, and it's so sad because it means that there's an increased risk of retinopathy, and it's a rare form, but most patients are not seeing their eye doctor before, during, or after they take semaglutide. So please see your ophthalmologist if you are taking semaglutide. Get your eyes checked because you don't want any vision loss. So we need to be more informed as consumers. There is so much misinformation about semaglutide. The FDA is not disclosing all the warnings of this medication. We have to get back to the root causes of obesity, and that is going to be the lack of plant-based foods, the lack of exercise, increased stress, hormone imbalance, and even xenoestrogens in plastics. So we have a lot of environmental toxins in our makeup, food products, in our cooking ware, and in all our packaged items. Why aren't we getting rid of the microplastics, the additives, all the artificial dyes and synthetic material? We have to be mindful of all the toxins in our environment. We have to know that there's increased risk of not just cancer and mental health disease and autoimmune disease, but also obesity. Make sure you know what those are. Another thing we need to look for are obesogens. What are obesogens? They are toxic chemicals in the environment that increase the storage of fat in our cells. They alter the rate of fat metabolism and also can alter the gut microbiome. So what does that mean? It means there are chemicals unknown and unseen if you're not careful. So there's about 50 obesogens in our environment. The most common ones are going to be BPA, pesticides, those things such as artificial sweeteners. So please check your ingredients and get fresh food. I know it can be tough for you, for those who've tried all lifestyle changes, including healthy foods, exercise, but know that when you have environmental toxins, it can disrupt your hormones. They're called endocrine disrupting hormones, and likely you already have high cortisol. And that's what the root cause of obesity is. It's cortisol levels that are really high, likely from the lack of sleep, the lack of stress management, and other toxins in our environment. We know obesity is a serious problem. Statistics show that 650 million adults in the US have obesity, and even children. Over 35 million children are affected with obesity. So we need a solution. We need a balance of traditional lifestyle and integrative medicine so we know what are the risks, the pros, the cons, what is the balance between it all. And getting to the root cause is key. Now, studies have shown that eating a plant-based diet over 12 weeks has decreased in not just BMI, but also high cholesterol levels have gone down, especially the LDL, and even blood sugars. So instead of putting your body at risk, consider having more plant-based foods. In addition, what works just as good as Ozempic, Semaglutide, and Wegovy? Fasting, especially intermittent fasting. It's the same thing. You're telling your body to take a break, to eat less and less often. That's what semaglutide does. It has a type of appetite control and also helps you not fixate on the foods and the cravings. However, if you're practicing mindfulness and meditation, you can also have this sense of calm and even control, and even a sense of trust. Trusting the process, allowing the body to get in balance in itself, allowing the body to appreciate the biochemical rhythm of rest, digest, and even getting into weight loss, recovery, decreasing all the other chronic illnesses, which can be from mindfulness, meditation, plant-based foods, exercising, even 10 minutes a day. So if you want to decrease the risk of depression, anxiety, and suicide ideation, the strongest research shows exercise is the medicine. So back to what I said earlier, we don't want that risk of harm and killing oneself. We want to increase the risk of vitality, longevity, mental well-being, mental fitness to endure the hard times, and to gain the coping mechanisms to allow yourself to endure the struggles of life. So if that's you, please get help and also see what I have to offer. I have tons of research. You can see my website with all these videos, documentaries, guides in my shop area. All the toxin-free guides are there, some plant-based fun challenges, a jump start. I'm here to help you so that you can be informed. Because remember, the FDA does not have you at the center stage, and it's profit over people. However, I'm people over profit. Please remember that my highest calling is your life, and I treasure you so, so much. So please be informed of the risk of this medication. If you want to see me in my clinic, I'm at drlifestyle.org. You can see how I treat patients with weight issues and how to implement medication safely and even supplements. If you want to hear more science research, I'm going to have a lot of more news to come. I'm Dr. Melissa Mondala, and see you next time. Thanks so much for joining.